I started being overused, I'd probably say 8th grade, freshman year. Not so much because of the coaches, just because that's when it got a little more competitive. And like when I had the chance to stay in the game, I would stay in the game, and it'd be hard to take me out just as a player.
How much is too much for young baseball players? The fastest growing segment of Tommy John surgeries are kids between 15 and 19 years old. In August, the Illinois High School Association will consider limiting the number of pitches and the number of games per week to keep players from injury. Dr. Anthony Romeo is a shoulder and elbow surgeon at Midwest Orthopaedics at Rush. He's also a co-team physician for the White Sox and the Bulls.
So, Doctor, when I was playing Little League in the 70s, nobody talked about pitch counts. Why is it taking so long to figure out that there's an issue here?
I think what's happened is that we've recognized that there's certain injuries in baseball that are fairly predictable, probably none more predictable than injuring the elbow as a baseball pitcher. And we saw that in our Major League Baseball pitchers, and we saw the number gradually increasing, which was of concern. But when we went and looked back over the last 10 years over the incidence of the surgery that's done for the elbow, which is known as Tommy John surgery, what we found out is more than 50% of the kids that are getting the surgery between 15 to 19 years old, and that number keeps going up about 9% per year. So we have an epidemic now in our younger kids having elbow surgery as baseball pitchers or playing baseball, and it's very similar in the shoulder too. So we recognize it in Major League Baseball first, but now it's been moved into our younger athletes.
And is that because there seems to be this growing trend of kids playing one sport and playing it all year round?
There's no question that some of the factors that are associated with this increased injury is how many pitches they throw, and if they're playing on more than one team at a time, and if they're playing year-round without a break. In fact, we looked at that and found that kids that grow up in colder weather areas have less of an incidence of shoulder and elbow problems than the kids that grow up in the warm areas. And the suspicion is because the warm areas, they're playing year-round.
So I'd imagine the pitch count varies whether you're 12 or you're 18. Is there a general guideline that you have out there, some kind of table?
There is some very good guidelines, and this is what we call empirical data. It's based on what we've seen as an ability to lower the risk of injury. So in our younger kids, we're allowing them to throw in a competitive environment 70 to 80 pitches. When we get to the Little League World Series, it's about 90 pitches, and then we keep it at that level pretty much throughout their high school years. And these pitch counts have been fairly well worked out, and it's been a project that we've worked on with Major League Baseball to have some references available for the coaches, the kids, and their parents.
And there's a website that does what? Has these tables there?
There's a website that's the m.mlb.pitchsmart.com. And this website, pitchsmart.com, actually goes over by age group. If you throw this many pitches, how much time you should take off in terms of being able to minimize your risk of injury. We also have a website through our practice at Midwest Orthopaedics called Shoulders for Life, which references many of these pitch count criteria also.
Just a final question on other sports, soccer, football, softball. Do you recommend that students diversify in the sports that they play? Because I think a lot of parents push their kids towards one because they think, hey, my kid's going to get a D1 scholarship.
Right.
And they'll be really good if I can dedicate.
Right. Part of the reason why we believe that these injuries are occurring more often is because it's very clear the kids see the Major League Baseball players. They make an incredible amount of money. They have a credible amount of fame, and so the thought is that if I play one sport and play it well, I can get to that next level. In fact, we believe that probably the best way to get to the next level is to diversify and become the best athlete possible. We've seen this in other sports. We all know the story of Jordan Spieth and how he was an athlete all the way up to about age 16 in multiple sports, and now one of the best golfers in the world. We think the same thing is true in baseball. It's very valuable to take some time off, 3 months to play basketball or play another sport, give your arm some rest, and minimize the risk of injury.
For more information, check out rushortho.com and search for Dr. Anthony Romeo.